Yeah, I'm Dr. Vikram Dalvi, and I'm a general medicine specialist. And first of all, thanks to GCCI for giving me a chance to talk to you. Now, as you will go through the lecture, you will realize that this is not only for you. We should be arranging such talks for, you must be having your large employee base, and they should be also listening to this. Actually, what I'm going to tell you might reduce my own practice, but still it is needed, so I'm going to talk about that. Right. So before we go into diabetes or blood pressure directly, we need to realize every disease has two types of risk factors. Some are modifiable or changeable, some cannot be changed. So non-modifiable is family history, age, gender, ethnicity, genetics. We cannot do anything to that. We are born with that. Occupational exposure, sometimes it is modifiable, sometimes it is not modifiable. There are modifiable risk factors, which is low level of physical activity, diet, being overweight, sleep, sedentary habits and addictions. They can be definitely changed. So we are going to focus mainly on this. I am going to come back to this slide once we go into diabetes and high BP. Next. Okay, now you must have heard prevention of a disease, but there are stages of prevention of a disease, and they are primordial, primary, secondary and tertiary. Now you know every disease has a risk factor. So if we prevent risk factors, then we are not going to get a disease. So suppose if people are getting electric shock, those who work in electricity department, they are at risk of developing electric shock and related injuries. So if I don't become electrician, that is a primordial prevention. Not practical, but just an example. Primary prevention is you already have risk factors, so the disease comes, but you prevent complications. Secondary, you already have complications, you prevent worsening of complications. And tertiary, a lot of complications have happened, but still we try to do certain things that help in leading active life. So these are 4 stages of prevention. Next. Okay, basically why do we worry about high blood sugar or high BP? Suppose the sugar remains 300 or BP remains 200 by 100. What does it do? Anybody?
It affects the heart and all.
Yes. So as you said correctly, they are silent killers. You are not going to get symptoms of diabetes or blood pressure itself unless it is too high, but it is going to keep on damaging multiple organs in the body continuously over years. And next. So they are risk factors for heart disease, brain stroke, that is Dr. Jyoti and Dr. Amruta are going to talk about. Risk factor for blindness, risk factor for kidney failure, then cirrhosis of liver. Diabetes is one of the major causes of cirrhosis of liver. A lot of people don't know that. Next, risk factor for cancers. Diabetic patients are more prone for different cancers. Risk factor for leg wounds, non-healing ulcers, gangrenes. Next. And risk factor for infertility. This is for younger people. Now we see diabetes even at age of 20-25. So this point is very important for them. PCOD you must have heard, polycystic ovarian disease. That is, diabetes is one of the risk factor for that. Next. So, okay, according to you, what is diabetes?
Sugar level up.
Okay, any readings you know of above what, below what?
120.
Yeah. So basically diabetes is excess urine and mellitus is sweet. So these patients pass a lot of urine which is sweet in test. That's why it is called as diabetes mellitus. This is one classic symptom of diabetes, excess urine. But this usually happens once your sugar goes above 300. Below 300, at 200, 150, you may not get this symptom. Then lab diagnosis, fasting is, sugar is more than 125. Post meal sugar, or what we do a test called oral glucose tolerance test. We give 75 grams of glucose and check sugar 2 hours after that if it is about 200. Or there is a test called HbA1c. A lot of you must have done this test at some point of time, which gives us an idea about sugar in previous 3 months. If it is more than 6.5, it is called as diabetes.
So, doctor?
Yeah.
If it is within that limit, is it okay?
No, what I have not described is there is a the stage called pre-diabetes, which is between normal and diabetes. Next. So types of diabetes. There are multiple types of diabetes. We are going to focus on type 2. We'll see why. First is type 1 diabetes. It happens quite early in age, around 8 or 10 years of age. I mean, these are children who are going to school. That is when they develop diabetes, and they have no natural insulin. The pancreas are destroyed by antibodies. But luckily, this is only maybe 3 to 5% of total diabetic pool. Okay, next. This is what we are going to focus. Insulin resistance. Actually, there is insulin, more than usual insulin, still the sugars are high. That is type 2. Next, gestational. So a lady gets pregnant. She doesn't have diabetes when she gets pregnant, but the sugar goes up during pregnancy. That is gestational. As soon as the delivery happens, the sugars normalize. But that is also important because these ladies are having higher chances of developing diabetes later in life. Okay, next. Then drug induced. Lot of patients developed diabetes during COVID because they received steroids. Steroids, one classic example of a drug causing diabetes. There are multiple other medicines. This is one of them. So drug induced is another type. Next. Then there are rare types, genetic defects that we are not going to look into because this forms less than 1%. So our focus is type 2. Next. So what causes type 2 diabetes? As I said, there is insulin more than normal, still the sugar goes up. Why? Next. There is something called as insulin resistance. Insulin is not working. Even though there is insulin where it is supposed to work and push the sugar from blood inside the cells, that mechanism fails. That is called as insulin resistance. Next. This is very closely related to visceral fat. Anybody who can tell me what is visceral fat? Any idea?
Fatty liver.
Yeah. So basically, viscera is the organs inside the body cavities, which is abdomen and chest. Okay. So the fat in and around those organs is called visceral fat. We are not worried about subcutaneous fat. We are more worried about the fat inside. Next. So many of you must have done ultrasound or have read a condition called fatty liver. So this is normal liver, and this is how fatty liver actually looks inside. And this excess fat is something that doesn't allow insulin to work properly. That causes sugar to go up. Next. Now this is heart, actual heart. This is natural fat. See the color and distribution. And this is excess visceral fat. So this is bad fat. This produces a lot of different chemicals that cause this insulin resistance. Next. Now important is, can you detect insulin resistance even before the sugar goes up? This is very important because if we detect that and if we do something, basically reducing the fat, then we can prevent diabetes. Or somebody who has recently developed diabetes and he has a lot of visceral fat, if he reduces visceral fat, he can get into something called as diabetes reversal or diabetes remission. So how do we detect if there is insulin resistance? Next. One, you develop certain skin changes. Next. Then there is a test called HOMA-IR. We calculate this based on your fasting sugar and fasting insulin. And we get an index. If it is about 2, it is called insulin resistance. Okay. Just to give you an example, suppose you have two cars, two vehicles, and they both travel for 100 kilometers. Okay. So which car has a better fuel efficiency? No, but in the numbers, which has better fuel efficiency? That we cannot tell unless we know how much fuel it used. Correct. So what we keep on doing is we just check sugars. But we do not measure how much insulin the body needs to control that sugar. So suppose you are maintaining normal sugar, but you need more insulin to maintain that sugar. That is low efficiency. And that is insulin resistance. So if we measure sugar as well as insulin at correct stage, not after you develop diabetes, before you develop diabetes, and we find that your HOMA-IR is high, that means you have insulin resistance and you can do something about it. Okay, next. So these are the skin changes you may have seen in others, some people may have it. These are called skin tags. Can you see them? These skin tags come if you have excess insulin, and you get excess insulin only when you have insulin resistance. There are multiple 1, 2, 3, 4, 5, 6.
Is there any color?
No, they are usually dark, not white. They are dark, or skin color or dark, either of that. Next, a lot of fat people, they have thickened skin which is black here. Okay, this is another sign of insulin resistance. So even without doing test, if you have multiple skin tags or thick skin here or in the armpits which has blackened, probably you have insulin resistance.
This can happen in kids also,
If they are obese, yes.
but they will develop.
Yes, the chances of developing diabetes is much higher. See, why we need to detect these things early is because when the sugar starts going up, your pancreas, the capacity to produce insulin is already down by 70%. Only 30% is remaining. So that is kind of too late. So we should detect these signs early, check insulin level. If it is high, then do something to reduce this.
Here is a blood test or
So it's a index calculated from fasting insulin and fasting sugar level. It's a calculation.
So it is done
blood
by
test, blood
blood
test.
test.
Yeah, blood
But
test.
normally people always check fasting blood sugar and maybe something like that.
That is after you develop diabetes. See, the definition of diabetes is based only on sugar. We are talking about what is causing diabetes. So to find a cause, we need that HOMA-IR.
Achha, after you are diagnosed with diabetes, then only HOMA-IR to be done?
No, if you suspect insulin resistance based on some skin changes or obesity, then you do the test to confirm that you have insulin resistance.
But will take if you stop the sugar taking, will that come down or what?
No, it's not that simple. We are going to come to
Lot
that.
of things.
Stopping sugar is not a simple solution. Next,
Doctor, did you say it's a blood test?
it's a blood test. Can you detect excess visceral fat? We now know that the visceral fat is the problem. That's our enemy. How to detect? Simple measure, waist circumference. You measure your waist at the level of navel. Less than 19 gents, less than 80 centimeters in ladies is the correct range. You don't need any special test. Measure this. Currently mine is 88, so I am just in the limit. Okay. Then there is a test called DEXA scan that can tell you how much fat you have in the body. Painless but costly test, 4,000-5,000 rupees.
But you have it here.
Yeah, we have it here. But we don't use it for this purpose because it is too costly. We use it for bones in this hospital.
But then people are ready to pay, then you can do it, no?
Yeah, but something simpler is available. There is something called as body composition analyzer. It looks like a weighing machine, sophisticated weighing machine, and that gives you how much of fat versus muscle you have in the body.
The one they use in gym.
Correct, same thing. That's not very accurate, but that is more than enough for monitoring. Okay, so these are three simple things that you can do. Simplest is waist circumference, just measure it. Less than 90 males, less than 80 females. Centimeters. Okay, next. So that was absolute basic about diabetes. Now we are going to come to blood pressure. This is another silent killer. Now this is a funny disease. Some patients do not get any symptom right up to 240, 250 of BP. Some patients start getting symptoms even at 140, 150. So if you go by symptoms, you are going to miss a lot of things. Okay, next. So it is called as systemic hypertension officially. Next. So the blood that is flowing in your arteries, it is at persistently very high pressure. Okay, and because it is flowing under very high pressure, it is going to damage the arteries from inside. That is one of the problems. Next. And how the blood flows? Heart is beating, putting pressure, that's why the blood flows. Now once you have excess pressure, the heart has to work against excess pressure to push the blood. So heart is also going to get affected. So arteries are affected and heart is also affected. Next. Yeah, next. So how do we diagnose blood pressure? You always check blood pressure in sitting position, ideally, unless the patient is unable to sit. It has to be checked in sitting position. Patient should be physically and mentally relaxed. And if we get high BP, we do not label patient immediately as high BP unless there are some other signs. We always check it after 50 minutes or next day. If we get too high readings, high BP, hypertension. Okay. So what is the normal BP? Below 120, and below 80. There are two pressures, all of you know. 120 is systolic, 80 is called diastolic. Okay. So below 120 by 80 is normal. Now elevated, we had something called as pre-diabetes. There is something called as pre-hypertension. It is up to 130, or this is below 90, below 80. This is elevated, still not diagnosed as hypertension. Then hypertension stage 1, stage 2 and hypertensive crisis depending on how high it is. So now anything above 130 systolic is labeled as high BP or hypertension. Okay. Next. So there are types of hypertension. We had types of diabetes, type 1, type 2, gestational and multiple. Similarly, there are types of BP also. One is called primary or essential, the other is secondary. Next. So primary or essential hypertension, that is most likely caused by environmental genetic factors. See, this is the BP that usually we get when we age, after age of 50 or 60, that is essential hypertension. There is no one particular cause as such. There are multiple factors playing together to cause the BP to go up. Okay. Next. And secondary, it is secondary to something else. For example, a patient who has excessively working thyroid gland, his BP will go up. So this BP is secondary to hyperthyroidism. If we treat hyperthyroidism, the BP settles. So secondary is secondary to some medical condition. Essential or primary, there is no basic cause. Non-specific factors are there. Next. So what are the risk factors for primary hypertension? Age, obesity, family history, race, diet, lot of alcohol, more than 8 drinks per week. Does anyone know what is one drink?
30 ml.
It is 45 ml of whiskey or rum or vodka, which is 42% proof alcohol, or 1 pint of beer. Okay. Then physical inactivity. Now, like type 2 diabetes, primary hypertension is, 90 to 95% patients that we see of high BP are of primary or essential. And then there are some causes of secondary hypertension, for example, oral contraceptive pills, NSAIDs, your aspirin, brufen, these medicines. Then antidepressants, steroids again, they cause high BP as well as high sugar. Kidney disease due to something else is going to raise the BP up. Obstructive sleep apnea and thyroid issues, Cushing syndrome. So these are secondary, but these are only 5% of the patients. 95 are essential. Next. So what lifestyle measurements we can use to reduce your blood pressure? Weight loss, that is if you are overweight. If you are already at correct weight, it's not going to help much. Limit alcohol intake, reduce sodium intake, stop smoking and reduce intake of dietary saturated fat. Engage in aerobic activity at least 30 minutes every day. 30 minutes is more than enough. And good quality and sound sleep of adequate duration. Next. Okay, now you may have or may not have seen these patients, but usually those who have these two diseases, they are on multiple medications. So we'll go through one by one. Next. So first, obviously, medicines to control sugar. Next, to control cholesterol, to control blood pressure, to control uric acid. These will usually have high uric acid. Next. Then because these two things are going to damage kidneys, something to protect kidneys. Then there is chance of heart attack, so something to thin out blood, aspirin, clopidogrel. Then a lot of people develop constipation due to diabetes, something for constipation. Then multivitamin, calcium, omega-3, this medicine, that medicine, alternative medicines, and all these are going to cause acidity. So acidity medicines. So you will see huge list. 2 days back, one patient had come to me to reduce the number of medicines. She had come with a list. She was on 25 types of medicine, 25, and each medicine either twice or thrice. So I don't know what food she was eating. Just tablets will be enough to fill the stomach, I think. So we want to avoid all this. Next. See, this is a problem with medicines. The medicines, they are going to prevent complication. There is no medicine to treat diabetes or treat BP. they prevent complications of the disease. See, we treat malaria means we give medicine and the malaria is cured. There is no medicine to cure diabetes or pressure. They just control the readings so that you don't get other complications. Okay, next. So you remember that medicines are good, they are needed if you want to have good quality long life. But at the end they just prevent complications. Next. Okay, now this slide again. You remember stages where the disease can be prevented? Can you enumerate them again? First one, primordial prevention. So in this case you prevent or treat obesity, you are not going to develop diabetes or pressure. Next. Then primary prevention. So you have developed diabetes and pressure, but then you take medicines so you prevent these complications. Next. Secondary, you develop complications. You develop a stroke or you develop a heart attack. So Dr. Jyoti and Dr. Amrut are sitting there to take care of that. See, up to this point, it is my role, physician. Once the patient comes to me on time, my intention is that the patient shouldn't go to them. Okay. So if my patient goes to them, that means I have failed. And if patient comes to me, that patient has failed. That's why he had to come to me. Okay. Yeah. Next. And then tertiary prevention. Some patients develop multiple heart attacks, some patients develop multiple strokes, they need physiotherapies, they need multiple things. Okay, so best option is preventing it here and here. Next. Now primary prevention for diabetes and hypertension is exactly same as primordial prevention of heart attack and stroke. Okay, next. And what do we do for that? Maintain ideal body weight. What is ideal body weight? Anybody can tell me? Ideal body weight. So what it should be? Any formula you know of? I am going to tell, of course. It is simple. For gents, height in centimeters minus 100. So if I am 171 centimeters, I should be maximum 71 kilos. And for ladies, it is height in centimeters minus 105. So if I am 171, I am a lady, it should be 67 or 65, 6, around that. Okay. Not only weight, we have to maintain ideal body composition. So the amount of muscle and fat in the body should be in correct portion. Next. So obesity leading to diabetes, hypertension, that leading to stroke and heart attack is a continuum. So it depends on where you have been told to arrest the progress. Okay. Next. Okay. So the most important step in preventing or reversing or treating these two conditions is, first we have to accept that being obese or overweight is a disease. So a lot of times parents come to me with their child 18-19-year-old, हमारा बेटा थोड़ा सा healthy है. They just don't accept that they are overweight. They call healthy. That is what has been put into our minds. So when I was 80, then after learning all this over years, then I lost my weight and I came to 70. My mother says, you are looking very weak. His mother says, he was, how much you were? He was 92, now he is at 74. His mother says, barik zala. So the perspective has to change. Okay, next. So this was one study about primordial prevention of obesity. This was done in children. 2-decade meta-analysis of prevalence and socio-economic correlates. See, basically this study tried to find out what was the percent of obesity in children, school children. Next. So childhood obesity was 8.4%. That is quite high, and being overweight was 12.4. So almost 20% of the kids were in overweight or obese category. And this percentage worsens as we start working, we go into our jobs, business, we don't get time to play. Okay. So this situation worsens further in adulthood. So this is our situation in 2023. Okay. Next. Okay, important question. Can we eliminate diabetes and hypertension completely?
As per age also it goes up.
Correct. So there are some non-modifiable risk factors which are sitting there. But diabetes and high BP were diseases of elderly after 60. Now we see patients of 25, 30. So what we want to do is push this back to 55 or 60 at least. Okay, so that is our aim. We cannot eliminate certain things. Next. So how to prevent or reverse type 2 diabetes and hypertension? Now you can answer.
Reduce weight, obesity,
I told you 3 points, 2 points in fact.
exercise.
Balanced diet.
So there are non-modifiable risk factors. We cannot do anything. Modifiable, diet and physical activity. Okay. Next. So optimal body weight. I told you, males height in centimeters minus 100, females height in centimeters minus 105. So today you go home, check your height, check your weight, find out if you are overweight, obese, at correct weight, whatever.
What is the difference between overweight and obese?
It goes as per the body mass index. Body mass index below 25 is considered normal. 25 to 27 is overweight. 27 and above is obese. Then there are
Obese is more dangerous than
worse.
overweight.
Yes. And achieve optimal body fat. Now, why this is important? There is a concept called thin fat Indian or thin fat Asian. So, our people, some look very thin, very well. I mean, height and weight is correct, but they still have a lot of visceral fat. Unless you measure, you won't know. So even though they are in the correct weight category, what they need to do is reduce the fat and increase the muscle mass. So just being in the ideal body weight category is not enough. Okay.
What is the test for the visceral?
Body mass.
That body composition analyzer, DEXA scan is there. Even if you do ultrasound that shows fatty liver, that means there is excess visceral fat. Something very simple that I have seen, it is not validated as such. You know what? Tell me.
But how can that fatty liver be eliminated, or can
See, when you lose weight, you lose fat also. So basically you need
So
to
that
lose
is
weight.
medicine.
There are medicines, but again they come with their side effects. Okay. Yeah, next. Baba Ramdev. He does, I forgot that thing called, I don't know what it is called. You pull the stomach in.
Yeah.
So if you have a lot of visceral fat, you cannot pull the thing in. If your stomach is going nicely and you're forming a cavity kind of thing, you have less visceral fat. Okay. So how to lose weight and fat? This is $1 million question, right? Okay. Next. Okay. So first step is diet. What is next step?
Exercise.
Diet. Next step?
Diet only.
Diet. What is next step? Diet. And next? Exercise. Okay. Main role of exercise is to maintain your muscle mass. When you are losing weight, you always lose muscle as well as fat. You cannot lose only fat. I want to lose only fat here. Not possible. You lose both. But what exercise does, it minimizes muscle loss. So mainly fat is burnt. Okay. So both are important, but diet is far more important. Next. Can someone read loudly?
What we eat keeps you alive. The other thing keeps you alive.
So thanks for keeping us alive. Okay. This is very important. This is extremely important. Next. So this person is under my guidance currently. His weight was 70.5. He is enjoying his life. Cake and milkshake and whatnot. And now his weight is, in 2 weeks, 69.35. So he has lost 1.25 kilos of weight. That is actually my photo. So I have lost weight. So this is put here to show that you don't have to give up your food items that you like to lose weight. You can still lose weight. The important is how much you eat and how frequently you eat. So portion control is very, very, very important. Next. No need of special foods. If you want to go to a dietitian, you can definitely go, no issues. And they are also effective, but sometimes they are not practical. Okay. what you need to develop is caloric deficit. What is caloric deficit?
How many calories you have to take?
Basically, you have to eat less than what you are burning every day. That is caloric deficit. So either you eat less, or you burn more, or you do both. Doing both is not that easy. Next. So eat less, burn more, or both. Next. Now timing of food intake is not that important. Okay. It is preferable that you eat between 8 in the morning, 8 in the evening, if possible.
But if it is
If it is not possible, like I usually have my dinner at 10:30 at night. It's just not possible for me to have it before that. Okay. It's okay. As long as you are going to caloric deficit, that's the primary goal, that you don't forget. A lot of patients ask me intermittent fasting, caloric deficit, what else that, caloric cycling, lot of things people ask. As long as you are going to caloric deficit in some way, you will lose weight. Now, how frequently you eat, how much you eat, as long as you are developing caloric deficit, you will lose weight. Just don't worry. Next. So, to develop caloric deficit, we should know what we are eating. So, do we know our food? Really, we know our food? This is famous statement by Hippocrates. Let food be your medicine. So, food is that powerful. Next. So, some examples, common examples I am going into. A lot of times when patient comes to me, I have developed diabetes, I have given up rice. Okay. Now, before we go into this, somebody said give up sugar. Somebody said give up sugar when you develop diabetes. So, if you are eating chapati or pav, how much sugar is there in it? Even if you are not added,
it is there.
how much? Any idea? Okay, one chapati is around 40 to 50 grams. Pav is similar weight, and these are made of wheat. Wheat has 75% of carbs, that is sugar. So 40 grams of chapati is 30 grams of carb, which is 6 teaspoons of sugar. So if you are giving up half teaspoon of sugar in your tea, but if you are not reducing chapati, what difference it is going to make? But does it mean that you stop eating chapati? No. You need chapati, you need carbs. So important is how many chapatis you eat. Understood? So that's why we need to understand our food. So is
And chapatis and bread, paos are similar?
no, chapati is usually homemade.
No, but I'm
That's-
saying in,
Well,
sugar.
there is some difference between maida and this thing, atta. So that difference comes into picture. Plus, they may use hydrogenated vegetable oil while preparing pav, which is not good for health. So is rice bad for diabetes? I think by now you know it is not bad. So I will show you some comparison. Okay. Next. So chapati 1 gram contains around 130 calories. Okay. Next. Pav, slightly heavy, it is usually 60 grams, 150 calories. And if you take rice, cooked rice I am talking about, 50 grams. Next.
White rice or
Any rice.
Only 65.
So if you are eating 50 grams of rice instead of 50 grams of chapati, you are automatically eating less carbs.
so if you eat dosa, it's much better than
No. We are going to come to that. There is a difference.
dosa is made of rice.
How do you prepare rice? How do you put it in cooker? Just example.
Water,
And then
double water.
Yeah. So, excess water goes out, but lot of water goes into the grain.
Yeah.
So you weigh your this thing, rice, tandul. You check your weight, and you make once it is cooked, you check weight. You will find that the weight has increased by 3 times, because 2/3 is water which has gone into the. So when you are eating 50 grams of cooked rice, 15 grams is the actual substance, 35 grams is water. Now that's why the calories are less.
So
Okay.
dosa will have more.
We'll go to that. Come, next. So we will consider different rice preparations. Next. So these are calories, carbs, protein. This for now you ignore. Just see the per 100 gram and calories. So steamed rice or cooked rice, 100 gram will have 130 calories. Next. Idli, which is close to dosa. It has slightly higher calories. Why is that?
There is other dal is there.
There is less of water in idli as compared to your cooked rice. Yeah. Now, presence of dal it improves the protein component. It was only 8% here, now it is 13%. Okay, but the quantity of water in the idli or dosa is less, that's why the calories are more. Next, puffed rice chiuda, kurmurecha murmurecha chiuda. It is also rice, but if you eat 100 gram, it gives you 473 calories. Why is that?
Oil.
Zero water plus oil has come into picture. Huh? Okay. So rice is good or bad depends on what preparation you are eating and how much you are eating. If you want to eat chiuda, you eat chiuda, but you eat only 10 grams. That's okay. You will even not even know when it has gone into your mouth, into stomach. Okay, next. Okay, next. So we are going to compare what do you call breakfast menus, 3 different breakfast menus. Suppose you eat 2 chapatis and 1 cup cabbage bhaji. You get 361 calories, 8 grams of proteins or only 9% are protein. A lot of it is carb. Okay, next. So we need slightly better. We reduce the chapati part because we know the carb is higher, and we choose usad in place of cabbage. Cabbage is all fibers. Usad is actual substance. You are actually eating less calories and protein are higher. 12 grams. Instead of 8, you are getting 12 grams of proteins. Correct? So this is a better option. Next. Previous. But we need something even better. So I eat chapati, half of this usad and 1 boiled egg. The calories are further down, protein is significantly better and carb is significantly less. So if you know your food, you can easily modify your breakfast. So that's why it is very, very important to know what you're eating. Next. Okay, now next. This again, we'll see what you answer. Next. Okay, now dal rice. Dal rice is a favorite dish. So you take 1 cup of dal, 100 gram of white rice, you get 173 calories and 5 grams of proteins. Okay. Next. We want to change it, so we take 2 cups of dal, we reduce the rice, amount of rice that you are eating. Calories are almost same, protein has slightly gone up because you are eating more of dal. But if you take this, what will happen? You have taken lesser rice, a lot of dal, so it is going to flow in your plate. It may overflow. So what will you do? That is one option. Otherwise, it is preferable to eat rice in a bowl. So you can take less of rice and more of dal. Becomes easy. Okay. Next. So now I find that dal is excellent. It has a lot of protein. So suppose instead of rice, I completely eliminate rice. And I take 3 cups of dal. So my protein has improved nicely. But does it make sense? Why it doesn't make sense? Calories are almost similar, just 10 difference. But there is a fundamental problem with dal.
Yeah, it's not too much of protein also is not good.
No, it is not too much protein. It is
Okay, then what is the problem?
what happens is these proteins are made of something called as amino acids. Some are essential, some are non-essential. Now dal is missing in 2 essential amino acids. Yeah. Okay. So if you eat only dal, you don't get those essential amino acids. But those missing amino acids are there in rice. So you always mix dal and rice or chapati and dal. Never eat dal alone. Okay, next. Chocolate. A lot of diabetic patients ask me, can I eat chocolate? So what is your answer? Huh?
Less
Dark chocolate.
dark chocolate.
Dark chocolate, less chocolate, what exactly?
They eat dark chocolates.
Okay, next. So Cadbury Dairy Milk, this is taken from internet, the data. So 100 gram has 524 calories, lot of calories. Carb is 57, protein is 7 and fat is 31 grams per 100 grams. Next. So as people said, dark chocolate. How many calories? Higher. Why is that? The carbohydrates are much less, but the fat is so high. See, 31 versus 45. No. Now there are 2 perspectives. Okay. If you don't want your sugar to shoot up, dark chocolate is better. Correct? But how do we treat diabetes? Reduce visceral fat. To reduce visceral fat, you have to go into caloric deficit. There, this scores better. So you should know what you're eating. So you should eat small amount of chocolate, preferably dark. So just because you're eating dark chocolate doesn't mean that you can eat a lot. You have still to be very, very cautious about how much you're eating. So that milkshake you saw, I mean, I had put my photo there. I had milkshake. I wanted to have milkshake. So what I had to do, I had to skip my dinner. If I have my dinner and then I have my milkshake, I'm not going to lose weight. That is not going to happen.
So dark chocolate is better than this?
Dark chocolate won't cause sugar spike because it has very less sugar. But it will still add to your weight, and your primary aim is to lose weight if you are overweight. So dark chocolate automatically, it doesn't become better as compared to other one. Next. Yeah, so with that we come to end of today's session. So basically diabetes and hypertension both have some risk factors which are modifiable, some are non-modifiable. We ignore non-modifiable. We look at the modifiable, which is your daily habits, food, exercise, addictions, and primarily we have to maintain correct body weight, correct body fat. And lot of times patient come to me, they say I do regular exercise but I don't lose weight. I do regular dieting, I don't lose weight, or my sugar doesn't get controlled. You have to remember, losing weight is the primary aim and diet and exercise are means to achieve that aim. Doing exercise is not an aim by itself. Okay. So I am going to need your help to do primordial prevention. So ideally this should start in schools at age of 10 or 12, where people, children, they start demanding various foods. We have to tell them how to eat healthy. And the ideal place is that Palak Shikshak Sangatna. Their meeting, PTA meeting is very important. But I think all of you have some base where we can have similar sessions and we go much more detail into food, and this is just a glimpse. We discuss a lot about food. Another session we discuss a lot about diet also. So if you give us opportunity, we can do that as well. Yeah. So thanks for this opportunity. Thank you.